You know, it is my pleasure to introduce Dr. Jim Ray. He is a brilliant man. He told, how much did you promise me to say that? But anyway, why don't you step on up here. Lee, will you get the lights, please? And okay, you got your going. Yeah. Here comes our ATM. Oh, there we go. Okay. Good. Just slip by here.
Hello, everybody. Can you hear me? Yes. In the back, can you hear?
Yes.
Yes. Okay, great. Thank you for the invitation to come today. It's a great honor to be here. For those of you who are veterans, thank you for your service. I wouldn't be able to do what I do if it weren't for you and the sacrifices you and your families made. So I want to get that said first. I want to talk to you today about Alzheimer's disease, which is what I do, is research Alzheimer's disease. And I was here, I think, in 2017. Does that sound right? And so let me tell you what I said in 2017. I said, Alzheimer's is a terrible disease, we've got to do something about it, but we don't know what to do about it, and we can't do anything about it. Any questions? And so now I'm back a few years later, 8 years later, and things have changed dramatically. That's why I wanted to call my talk today A New Age for Alzheimer's Disease. So maybe for those of you who unfortunately missed my first talk or may have not remembered everything I said from 8 years ago, I would just start from the beginning and try to remind everyone what Alzheimer's disease is. So Alzheimer's is the leading cause of dementia. And a lot of people confuse those terms, and there's a good reason why. But dementia is a symptom. Alzheimer's is a disease. And the main symptom of Alzheimer's is dementia, if that makes sense. So the number one cause of dementia in people over the age of 65 by far is Alzheimer's disease. And it's a very common disease. About over 7 million people in the United States have it right now. And globally, that's 57 million, but in so many countries, the developing world, it's not even diagnosed. So that number is too low. And so what happens when you get Alzheimer's? What are the symptoms that you get? So the most common first symptom is repeating questions, because your short-term memory's going, and like you'll be at lunch with somebody, and the waiter will come, they'll say, today's special is a salmon. And then the waiter comes back to take the order, and the person who's getting Alzheimer's will say, are there any specials today? Yeah. You're like, Mom, they just told you it's a salmon, right? 5 seconds ago. So those kinds of little, and we all forget things, and the older you get, the more you forget things. That's just the way life goes. Your muscles aren't as strong, your bones aren't as strong, your brain's not as quick. But then it evolves into something that's a lot more troubling. There's a confusion about where you are in time and space. I'll give you a good example. There's a lady who got Alzheimer's in a small town in North Carolina. This is a town of 15,000 people. She was the only realtor in that town. Oh, no. She had sold every one of those houses in that town multiple times. She got lost on the way home. That's not, oh, I'm getting older and I can't find my car keys. That's something different, right? And that's about usually when the relatives or the spouse of the person say, okay, it's time to go to the doctor. Now, what's going on inside the brain of someone who's developing Alzheimer's disease? They're developing two main changes, pathological features of the disease called plaques and tangles. And we're going to talk a little bit more about them today. But these are the two things that when you look under a microscope in the brain, I'm going to show you some pictures in a minute, that a doctor can see. Of course, they can only do that after you're gone. You can't stick a microscope in your ear and see them. But if you were able to do that, you'd be able to see them. But the main thing that's happening is your brain is shrinking. So your brain, if you have Alzheimer's disease, winds up being about 40% smaller than someone your age who never got Alzheimer's. And it's just the shrinkage of the brain. And the shrinkage is really prominent right behind your temple. And that's called your medial temporal lobe. That's where everything I just said is temporarily recorded until you decide whether it was interesting enough for you to try to remember it. So with that part of your brain gone, you just can't remember that salmon was the special. Does that make sense? Because that part's leaving you. A lot of people, is it?
He's going to turn it down a little bit.
It's too loud. Is it too loud? Okay, all right then. Oh, feedback, gotcha, okay. We'll make sure it wasn't something I was doing. Okay.
Not you.
Okay, so a lot of people don't realize that Alzheimer's is a fatal disease. They think of it as, this goes for historical reasons. Oh, it's just something that happens to folks when they get older sometimes. But it's actually a disease that can cause the brain to atrophy to the point where it's fatal. In fact, more people died from Alzheimer's than breast cancer and prostate cancer put together last year. 50% more. So it's a very, now lots of people who get Alzheimer's because they're older will die of a heart attack or something else before they die of Alzheimer's. But it's still the 6th leading cause of death in the United States. So a couple things we have to understand before we start tackling this problem of how do we deal with Alzheimer's disease. And this is one of those good news, bad news scenarios. The good news, in a way, is that Alzheimer's takes forever to develop. This is not something you caught last week. It happens over maybe 30 years, at least 20 years. It's slowly developing. And just to show you the timeline, there are changes going on in your brain that we have now, I'll talk about in a minute, we have diagnostics that can measure some changes happening in the brain 20 years before you might start to suspect there's some small changes like you don't remember the salmon special. That phase, that next phase is called mild cognitive impairment. It's very difficult to distinguish from normal aging, and that lasts on average 5 years. Getting lost in your hometown that you've lived in for your whole life, that's when you get diagnosed with dementia, and then the disease lasts another 7 years on average. So this is a it's a big train, but it's a slow moving train. So the bad news is by the time you get to the dementia diagnosis, you're 25 years into a disease process. It's very difficult to stop a disease that's been going on for a quarter or a third of your life at that late stage, particularly if you're losing brain tissue that you can't replace. Scraping your skin is one thing, losing brain tissue is a different thing. So what causes this disease? Well, first of all, in some cases it's inherited, but these are rare, like maybe 1-2% of the time. And you can tell it's inherited for 2 reasons. It runs in the family really strongly, like half the people in the family have it. And number 2, I don't know if anyone's ever heard of anyone getting Alzheimer's at age like 50 or 52. That's early onset Alzheimer's. That's usually inherited. And that can be transmitted from generation to generation, just like eye color or something like that. But so that's a small percentage. The rest of everyone else, no one really knows why you get it. It's called sporadic. It's something that happens as you get older. We know some risk factors. Age, of course, is the biggest risk factor. No one under the age of 65 will develop sporadic Alzheimer's disease almost. It's very rare. So age is the biggest risk factor. There's a gene called ApoE4. Did anybody here do 23andMe? Did y'all ever do that? And they tested to see if you have a risk for Alzheimer's. They didn't tell you the name of the gene, but they were testing for ApoE4. ApoE4 is a gene that's in 13% of the population, but it's in 45% of Alzheimer's patients. So if you carry that gene, you're 3 times more likely to get Alzheimer's. And it's a pretty common gene. And then there's a lot of other things that contribute to your risk. Cardiovascular health, whether your blood pressure is under control, your cholesterol, your blood sugar, whether you have obesity in midlife. These are all things that are not good for your heart, they're not good for your overall health, and your brain can suffer as a result. But more specifically to Alzheimer's, low educational attainment is a risk factor, probably because people who have reached a high level of education are better able to hide or trick people into thinking they remember everything right. They're used to cheating on the test. Social withdrawal is really bad for people who are on the path to dementia. It accelerates it. And insomnia and depression. There's a little bit of a cart and the horse problem. Like, is the dementia causing these problems, or are these problems causing the dementia? But they're probably interacting and not good for you. So this is going back, remember I showed you this, and I didn't explain it very well. On this y-axis is how bad something is getting, and on the x-axis is time. And what you're seeing is things getting worse in Alzheimer's patients, typical Alzheimer's patients, over time. And so now we know lots of things that are going on. The brain is shrinking, that's late. Memory is changing, that's right before the brain starts shrinking. You get loss of the synapses that connect your brain cells together. That happens right before that. The very first thing that happens is that red line. The very first thing that happens in Alzheimer's disease are the plaques. You get plaques in your brain, it's the earliest known change, and this can happen over 20 years before your very first concern that your memory's changing. So for something to be a cause, that's one of the criteria. It's like it's the first thing to happen. How can you cause something if you're the last thing to happen? So that's one of our strongest clues about what might be causing the disease. So what are these plaques? Well, if you look in the brain of an Alzheimer's patient, under the microscope, you can see these deposits of proteins in the brain that your brain can't get rid of. And they're just called plaques. Just like plaques in your arteries, you can get plaques in your brain. Those plaques cause inflammation. So your brain has a different immune system than the rest of your body. It has its own immune system. And so it makes it very unique. And it's trying its best to fight off these plaques. And it either does a good job of that, or it doesn't do a good job of that. And depending on the outcome of that battle, you may start to be able to handle this, or might start going down the path of dementia. Then you start, because of the inflammation, you start to lose the connections between your brain cells. Maybe it takes you a little bit longer to find just the right word, or remember the salmon special. I'll keep going back to that. But you're still not dementia. You start to get to dementia once you get to the final stage, which are the tangles. The tangles, which are made of this protein called tau, is what actually kills the brain cells that make it shrink. And these spread almost like viruses through your brain, slowly but inevitably, going backward in time, taking away memories from today, then yesterday, then last year, then 10 years ago. So can we stop Alzheimer's disease? Okay, last time I was here, this is where I stopped my talk. This is it, it's all bad, and thank you for having me. But now I can add a few new slides. So this is now, remember I told you that the doctor can't stick a microscope in your ear and see if you have plaques? Mm-hmm. Well, now you can identify the plaques in a living human patient using a technique called PET imaging. So these are radiochemicals that will stick to the plaques and glow. And when you look in the brain of somebody who's got Alzheimer's disease, you read this like a weather map, like it's going to rain in San Antonio. So you see some rain, you see some plaques showing up in the patients with Alzheimer's disease using this technique. Now this person had some plaques, and they were given a placebo treatment for 18 months, and you see the plaques got worse. This person was a volunteer on a clinical trial for a drug called Leqembi now. It was called lecanemab before it was approved. And they start out with a similar amount of plaques. Their plaques are gone in 18 months. So this works by, you have, the antibody drugs, the biologic drugs for COVID? The same thing, except they're not targeting COVID, they're targeting the plaques. So they bind to the plaques and the immune system tries to kill them. So it's helping the immune system do its job. And those clear the plaques. All right, so does it work? Oh. Now let me show you how to read this. And I promise I won't show you too much data, but I want to show you this one. So on the y-axis is your cognitive score, and these are Alzheimer's patients, so it's going to go down because Alzheimer's inevitably goes down, right? And so the patients are all going down. This is over the period of months. And these people on the bottom line, they went down more. That's because they were the placebo group. The people in the red, they got that drug that clears the plaques, and they didn't go down as fast. So, in fact, they went down 27% slower. Now, this is not a cure, they still went down. And this doesn't work at all once you get to the point where you really have dementia. You have to catch it super early to even see this effect. And these drugs are expensive and have side effects. You have to have careful monitoring for brain swelling with MRIs, and they're not the greatest drugs ever. Yet, at the same time, this is medical history. We've never slowed a disease like Alzheimer's, like Parkinson's, like ALS. So I compare it to Sputnik. That didn't get us to the moon, but you knew once you got there, the moon is not far away. So we got into orbit, at least with this. And now there's 2 drugs like this, and they work very similarly, both approved by the FDA in the last 2 years. But there was an important clue in what I just said, and since I'm not quizzing you, I'll just go ahead and tell you what it is. So, remember I said it only works at the very earliest stages, and once you start to get, well, that means something. That means that the plaques may be important early, but the next stages must be independent of the plaques. Because remember, the drugs cleared the plaques. But a lot of people didn't respond. The people who were later in the disease no longer responded to the drug, which means the inflammation, the synaptic loss, and the tangles, the next steps, once you set the wheel in motion, it doesn't do any good to go back in time and get rid of the plaques. There's a disease process going. So we didn't know that. That's a really important lesson. So now, if we want to now take this to the next level, and obviously we have a long way to go before we really manage this disease, we're going to have to take on these other areas. Oh, I went the wrong way. There we go. And now we think, though, those next steps can actually stop the disease. So let me give you this one example. Did anyone see on 60 Minutes where they did this special on this family in Colombia that inherits Alzheimer's disease? Some of y'all saw that?
Yeah.
So they're an isolated village in Colombia. They had a mutation that causes Alzheimer's, which is not usually the case, right? And they were so isolated, they didn't know that this was not normal life, because 50% of their people in the village would get this mutation and they would start dying of Alzheimer's in their 40s. And they just thought, well, that's what happens to about half the people in the world, I guess. But it wasn't, it was just them. And so scientists identified the problem, the gene, and by the way, it makes plaques.
Oh.
So that's a clue to it, right? And there's following this family, and there's that lady shown there who got the gene, and they told her about it, and they said, you've got the gene. She kind of figured she did. Her sisters had already died in their 40s. And then she lived through her 40s. I'm lucky. She lived through her 50s, 60s. She died at age 77 with no dementia. Now, how is that possible? Remember I told you the risk factor ApoE that 23andMe tests for? She won the lottery ticket of life. She developed spontaneously at her conception something in her ApoE gene that turned it from a risk factor into a protective factor. And it stopped her Alzheimer's disease. She got her brain was full of plaques, but she never got to the tangles. So conceptually, this tells you, you can stop Alzheimer's. I mean, she did it by inheriting a gene. But maybe we can make a drug that does the same thing. It's possible, right?
Sure.
And so ApoE is on chromosome 19, and it comes in 3 flavors, number 2, number 3, number 4. Number 4 is the bad one. And what I'm showing you here is it's not just this one lady. The bad form of ApoE is in the red line. And when you have 2 copies of that gene, you have a 50% chance of having Alzheimer's by age 70. The good form is the number 2. And when you have 2 copies of that gene, you can live to be over 100 with an 80% chance of never getting Alzheimer's. So this is a very important way to approach the next step. Okay, moving along, that's one way we're going to go after it. We're going to go after this ApoE thing that can stop the disease. Number 2 is the immune system. So what we've done, technology's advanced to the point where we're able to do genetics on not just eye color and things like that, but on very complex traits that have thousands of genes participating, like Alzheimer's disease. And try to understand what are the genetic profiles of people who get Alzheimer's versus who don't. 1 million people have their DNA analyzed, and these are Alzheimer's patients and their first-degree relatives. And we got all the genes back. 75 new genes were discovered. Major breakthrough in the field. We had 1 ApoE, now we got 76. And all those genes were related to the immune cells of the brain. They're called microglia. So all of a sudden we had this huge awakening. It's the immune system of the brain that we need to be fixing. And you can see why. In the blue is a plaque that you're trying to fight off. And in the white are the immune cells that are supposed to be fighting it off. In people who get Alzheimer's, it looks like that on the left, where they didn't fight. And in people who escaped Alzheimer's disease, it looks like that on the right, where the immune cells surrounded the plaque and wouldn't let it kill the neurons. Well, we think this is really interesting because at MD Anderson, we have immunotherapy for cancer. I'm sure everybody's heard about this, where Jim Allison, who won the Nobel Prize for this, and his colleagues said, we can teach the immune system to kill cancer. Well, we're just going to take we're going to steal his ideas, okay? Don't tell him I said that. But we're going to take his ideas, the same concepts he used to fight cancer, and use them to fight Alzheimer's disease. We're going to turn the brain's immune system against Alzheimer's disease. That's one thing we're working very heavily on. I think there's also a very important role of sleep. Who slept perfectly well last night? We got 2, 3 people. Okay, we got 4. So it is harder to sleep as you get older. No one sleeps like a teenager, right? It gets harder to get sleep as you get older, but it's particularly a problem for Alzheimer's patients, and they have a specific type of sleep disturbance. A lot of people call it sundowning, where you get super sleepy around 5 o'clock, you have to wake them up for dinner, then they get grouchy, and then they go back to sleep real early, and then they're up at 2 in the morning, potentially wandering out of the house, deciding maybe in their confusion that it's lunchtime, it's time to heat up the stove. Maybe I need to drive down to the end of the driveway and check the mail. And this is what drives the caregiver family crazy. They can't take it. Grandma may wander out of the house at 2 a.m. and get lost as they wind up and put them in the institution. So if we could help Alzheimer's patients sleep, we think it would preserve their brain function longer and also keep them out of the nursing home. And so, our group is a consortium of multiple institutions, MD Anderson, MIT, New York University, Brown University, and Baylor. And one of our stars at Baylor is Dr. Jeannie Chen. She's holding up the Michael DeBakey Award for discovering exactly what causes the sleep problem in Alzheimer's patients. It's not insomnia, it's a completely different problem related to the disease process. And she can recreate that problem in mice and then cure it with a drug that's already FDA approved. So we're starting a clinical trial on Alzheimer's patients who are having trouble sleeping and are sundowning a lot, and seeing if we can just get prescriptions written for these folks and if it'll help them sleep. But we think sleep is a very important area. But the final frontier are the tangles. Because, once those start spreading, like I said, it's like a virus. It's very difficult to stop. You just want to not catch it in the first place. So we have to figure out how to do something to stop the tangles. Maybe the things I just showed you will make it so that people don't get there, but what if you're already at that stage? And so that's what the final frontier, as I see it today, is for Alzheimer's. What I think will help us address the tangles, or maybe some new therapies, but the most important one is early detection. Because, if you remember from the beginning, it's a long, slow disease. We have plenty of time to catch it, way before you get the tangles. So maybe we don't really need to fight the tangles. Maybe we just need to find the disease early enough. Well, today, in the airport, we found out the FDA just approved its second early detection blood test for Alzheimer's. So we can now detect, the really good test is still under review. That's coming soon. The new test that's under review can detect Alzheimer's disease at least 10, maybe 20 years before you get symptoms. And once you get worried that you might be getting Alzheimer's, this test can diagnose you better than the head of neurology at the Mayo Clinic. Yeah, it's that good. And I would love to tell you the whole story behind the technology. It's unbelievable that led to these tests even being possible, but they're detecting tiny pieces of neurotoxic matter coming out of your brain into your bloodstream. That's specific for Alzheimer's. So can you imagine what it would be like as part of your routine health care? You go in for your annual checkup, they tell you your cholesterol, your PSA if you're a man, your blood pressure, and your Alzheimer's score.
Yeah.
That's going to change everything, right? And when we're doing clinical trials of new drugs, we can just use the score instead of asking grandma, what did you have for lunch yesterday? Now, how reliable is that? But now with an objective score that can be monitored weekly with a simple blood test is going to make it so much easier for us to develop therapeutics. And I'm going to close with this because ultimately, detecting it early is great, but preventing it's even better. So it'd be better if there's nothing to detect. So a study was just published recently called Pointer. And Houston was one of the places where it was conducted. And what they did, they took older people at risk for dementia. They didn't have dementia, but they had some of the risk factors. And they assigned them to one of two groups. One is, we're going to tell you some things you should do. You should eat the Mediterranean diet. You should go exercise. You should have one alcoholic beverage a week, no more. Go down the list of all the things your doctor yells at you about. Mindful yoga, social interactions, memory quizzes were some of the ones special for Alzheimer's. The other group, they actually made them do it. They didn't just tell them to do it, they made them do it. And then this is their memory. Now remember the other graphs I showed you is always going down? Because Alzheimer's, everything goes down. Look at that. Either group, the one that got tortured, that's the structure group, and the one that was just given some advice, both improved their memory. Now, these people did not have Alzheimer's. If they did have Alzheimer's, they were just at risk. If they did have Alzheimer's, they would have gone down, because it's once you get to that stage, it's inevitable. But this gives you hope that before you get it, you might be able to do something about it. Okay, then finally, last slide. I don't know if everyone is aware about this, but it's a historic moment for dementia research in Texas coming up November 4th. There's an opportunity for the state of Texas to invest $3 billion of our budget surplus to become the nation's leader in dementia research. And it's called Proposition 14. It's $300 million a year over 10 years. We did this for cancer called CPRIT, the Cancer Prevention Research Institute of Texas. This would be the Dementia Prevention Research Institute of Texas. And so if you are concerned about dementia, think we should be doing more about it, you have an opportunity to stand up and vote yes on Proposition 14. I'd never do this, but I really want that money. So please get out and vote. And thank you so much for having me here.
Wow, what a presentation. Let's do some questions. Got a question back here, Lee?
I recently received a communication
offering me a clinical trial for a statin drug as an Alzheimer's trial. What can you say about that? Do you know anything about that?
I do. So statins were tested in the early 2000s. Both Pfizer and Merck tested their statins, which are the two most famous ones. In Alzheimer's patients, they didn't work. But we had no idea how to test drugs in Alzheimer's patients back then. So it's hard to say whether they just didn't work or we didn't know what we were doing, to be honest. My personal opinion is that is not at the top of the list of the most exciting new things out there. Yeah, if I was talking to my mom and she said, I'd be interested in, and I'd say, Mom, let's find you something a little, that I think is a little more exciting. I know there are still people who think it's possible it could help, but I'll tell you why I say that. How many people take statins? So there's already a lot of people on statins and we still get Alzheimer's, so.
I ought to tell you something, huh? All right, other questions? We got a question over here. Go ahead.
Is white matter the same as the plaque?
Is white matter the same? No, ma'am.
No.
So that's a really good question.
Would you repeat the question?
Is white matter the same as the plaques? So there's the gray matter and the white matter. The gray matter are the neurons that make communications to each other. The white matter is the insulation. It's the rubber around your copper or aluminum wires in your house, right? That prevents wires from getting crossed. You get a short when your wires cross, right? So you have to insulate your nerves from each other or their electrical signals will get crossed. So white matter is very important. Your brain can't function without it. It is going down in Alzheimer's. If you know anyone who has multiple sclerosis, that's when your immune system attacks your white matter. And they get progressively worse and worse over time. It just shows you how important it is. And did you ask that for a specific reason? Or
My white matter is going up.
it's going up?
Yeah.
Okay, well, good. That sounds good to me.
Also, the small vessel disease, is that your little tangles?
Okay, so that's another really good question. The second leading cause of dementia behind Alzheimer's is what is cerebrovascular disease. It's called vascular dementia. And that's just where your brain's not getting enough blood flow. And of course, in severe cases, that's called a stroke. But it can be chronic, suboptimal blood flow over many years, and your memory will start to suffer. And so some doctors call that small vessel disease because your brain is 2% of your body weight, but consumes 20% of the oxygen. It's the most blood-dependent organ you have in your body. So any little compromise in blood flow to the brain is impactful over time, and that's what they're referring to. It's not the same as the tangles quite.
Okay.
Question over here.
Got a question over here. Rod?
You mentioned the blood test. Is there a specific name that you give the doctor that you want tested like that, or will that become a part of the ordinary blood analysis that whenever we go for our physicals?
So this is too new for me to have good answers for these kind of questions. I'll just be honest with you. That a lot of your general practitioners aren't used to prescribing this. They don't know how to read the numbers. And in fact, as a male over a certain age, I get my PSA tested. People have been doing that for decades, and we still argue about what it means. So it's going to be the same with Alzheimer's tests for a long time. If you feel like you have a specific concern and you want to know if this is Alzheimer's or something else, then you can talk to your doctor and say, I'm really interested in this blood test. If you don't have any reason to be concerned right now, then I think that your doctor's not going to feel comfortable and he's not going to know what to tell you with the numbers, and there's not going to be an action you can take at the other end. Does that make sense?
All right, another question? Got, right, go ahead.
Is there any
Oh,
bullet?
I'm sorry, we got I think, I'm sorry, he was pointing somebody else that has the mic. We'll come back to you,
You mentioned,
if I can remember.
you mentioned that sleep is something that we should all be aware of. Can you talk to the importance of CPAPs for a lot of people who are having difficulty sleeping? Because many people who suddenly have a CPAP find that they are breathing better, sleeping better, feeling better. Can you talk about that?
Yeah, so absolutely. So the question was about CPAPs and sleep apnea. Sleep apnea is not a good thing to have. I think everybody knows that. It's bad for your health. Having your airflow constricted to your brain, we just talked about that, how much your brain needs oxygen. Not good. We're trying to run that sleep study I mentioned earlier, and we keep having to throw the participants who are volunteering out because they actually don't have an Alzheimer's related sleep problem. They have sleep apnea, which our drug won't treat. That's how common it is. So absolutely, personally, I'm not an MD, but based on everything I know, definitely you should be treating your sleep apnea with CPAP or some other way to make sure you can sleep with oxygen all night.
Okay, got a question over here, sir?
Yes, sir. Could you address CAA?
Cerebral amyloid angiopathy is what CAA
Oh,
stands
that's
for.
what that is.
Yes, I'll beat you to it. So that means amyloid is the plaques. So the same plaques I was talking about before, but they're in the blood vessels. So the brain blood vessels, that's all that means. CAA just means you have plaques in your blood vessels. So people who have CAA can have strokes because their blood vessels are getting rigidified with those plaques. They can have cognitive problems for the same reason we were discussing earlier. And it can be either isolated disease itself, or it can be part of Alzheimer's. When it is part of Alzheimer's, and you take one of those new Alzheimer's drugs, you're at risk for getting a brain bleed or a brain swell. So that's why you may have heard about it in the news a lot lately, and if you know someone who's a candidate for these Alzheimer's drugs, they're going to be looking out for it to see if you have CAA, which just means plaques around the blood vessels.
Okay, we've got only a few minutes left, but Hugh will be here so right here. Okay, we'll get you more.
Hello, can you speak to the quality of sleep? Some of us, me, have trouble sleeping, but I have some medication that helps. Is medicated sleep as restorative and as health affirming as unmedicated sleep?
That's such a great question, and I should first say I'm not a sleep expert myself. I'm not someone whose primary research interest is sleep. But yeah, I don't think it is. I think a natural night's sleep where you progress through REM to non-REM to the slow wave, there's a natural cycle to that. That's the healthiest form of sleep. So if you can sleep for 7 to 8 hours without any medication, I think that's probably better than if you need a little help. But if you need a little help and it helps you sleep, that's better than tossing and turning all night. So it may be that your choices aren't here and here, it's somewhere in the middle, you have to do a little compromise. I think people who use alcohol to help sleep, to use things like Xanax and other benzodiazepines, these are all known to make you even groggier the next day, not restorative sleep. So I think it just makes sense that a lot of these sleep aids, taken rightly, may help a little bit, but they're never going to be as good as natural sleep.
Okay, right over here.
Are there any currently on the market immune-building supplements that might help us build our immune system in our brain? Antioxidants, quercetin, magnesium, anything?
A great question. Short answer is I don't know for sure. I mean, I know the area very well, and there are people who say, here's something you can take that'll help your brain's immune system. There's very little evidence to support any of those claims. So there's people who say stuff, but it may be true, it may not be true. You don't have the level of evidence for that. Most of the drugs that are targeting the brain's immune system are all brand new and are early stage trials, and we don't have the data yet. So give it like 2 or 3 years, and I can answer that question a little bit better. But one thing you can do is exercise. Exercise will help your brain's immune system.
What is that?
Exercise. It's this thing you do where
Oh,
you
be darned.
go for a walk or do something.
Oh, that's interesting. Got a question here.
Is there any validity to herbal remedies that are making all sorts of claims?
I think there is. I think there will be natural interventions, dietary interventions that are going to be very useful in Alzheimer's and other diseases. The problem has been, and it kind of relates back to your question, is people don't bother to generate the evidence to make it believable. So my mom drives me crazy. Everything she sees on Facebook, she texts me about. I just saw that if you eat blueberries, you won't get Alzheimer's. So bears, is that why bears don't get Alzheimer's? It doesn't make any sense. I mean, no one has run a phase 3 clinical trial in 3,000 patients and proven that this herbal supplement is better than placebo. No one does that. So you're left with just claims. It makes it very hard. You hear it all the time. You hear stuff all the time, right? How do you sift through and sort? Well, I say never, but that's not true. Fish oil was taken all the way through all the phase 3 trials, and it was proven to lower your triglycerides. And so there's things that people do actually believe in and trust and prove. And if you use Google and whatever research tool you use and ask the hard question, has this been tested in randomized controlled trials? What is the evidence for this? That, you know, the AI component of Google is really good at answering these questions now, so my mom emails me a lot less frequently.
It's 1 o'clock. If Jim will stay here a little longer if anybody wants to come ask questions. I want to thank you first of all, and I'd like to give you the Art Challenge coin.
Oh, wow.
And we challenge you to come back. Thank you so much. What a wonderful talk. Again, he'll be here if y'all want to come ask some questions.